you apply this point, normally what happens, I told you is the adrenergic point, and also this point to be known as the gonads points as well. Gonads is indicating here, that is the testicles for the males and ovaries for the females. Having any kind of the problem, there is a semen related problem, ovulation related issues, or maybe the egg production is not good. In that situation, try to apply the needle. Maybe I can apply the half-tune needle, or we can apply the lancet as well. I just apply the lancet, or we can apply the needle sometimes. So anyone you can apply. Whether what is the reason to apply the lancet? Again, there is a reason. By the way, you can use the this is the Sanjo 1, is a grand sun point, sedative point, depletion point, and also it decreases the energy of the small intestine, the triple warmer. So when the triple warmer reduces the energy, then that passing to somewhere else, where it passes is equivalent to the Li5, Yang Z point, that means is Li5. So it's communicating to the large intestine, and also this is the lower geo to be activated. Now I told you there are the three junctions, upper, middle, lower. Now 3 points I will tell you, only the 3 points it covers to all the 3 geos. But now this point to be treatable for the lower geo, since it's connecting to the intestine. Intestines are connected on the lower portion. In that case we can use this point. So when there is a problem, lancet, why I just used this, I just withdraw this and then started bleeding here. How many drops of the bleed we need to withdraw? We can bleed this as much as, yes. So we can withdraw maybe multiple times, we can withdraw this. Yes, 50 drops we need to withdraw, we can withdraw when it is required. Remember the normally what happens, the heat and cold to be balanced properly. When the heat gets excessiveness, that also could be the reason to get the hyperpyrexia. Children, they do have the temperature, even adult having the temperature, that need to be minimized. So that time we can bleed this point, because the triple warmer having the excessive heat in the blood could be the reason to cause the hyperpyrexia. You just try to drain out this, the blood stasis which was accumulated, you are drained out one or other way will be good. When the patient is complaining, I do have the pain on my shoulder region, on the lateral portion of the pain, she do have that, indicating the triple warmer energy having the stagnation could be the reason. So therefore you just bleed it so that the entire meridian gets releases here. So hopefully you can understand. Then the second point to be, by the way, is the adrenal gland, adrenocorticotropic hormone, and also stress hormone. Further it is the cortisol will going to release by using this particular point. The vein which we bleed, this vein called as a digital vein, we bleed it here, so that one or other way will be good. The second point to be known as a Yemen, where exactly the point is located. So exactly you can see midway between the fourth and then fifth finger, at the junction of the black and white skin, you can see just proximal to that region. Sometimes it says the half tune proximal to that region, this point is located, right? We can use this point to treat for the normally this point is good point to treat for what condition? Yeah, good. Mammary gland and also pancreas as well. This treatable for the, no doubt, I told you maybe thyroid as well, but this is a mammary gland, that means the breast related disorders. Further also useful to treat for the pancreas as well. Spleen and pancreas also can be treatable, since it is the endocrine point as well. Now coming to the third point, but this point is treatable for the thyroid and parathyroid point as well. Now I just wanted to use as a through needling to treat for this problem, and further I just apply this point is Sanjo 3 point, I just apply towards the Sanjo 2. Sanjo 2 and then Sanjo 3. 2 points together I just activated, but this point is, both the points are treatable for the parathyroid and thyroid point as well. By the way, this point also treat for the pineal gland. Of course, this entire region can be treatable. One more needle, one tune. But now I just try to find out where is the metacarpal bone at the base. midway between the fourth and fifth metacarpal bone base in the depression. This point is treatable for the thyroid and then parathyroid, pituitary gland and pituitary hypothalamus and also pineal gland. Right? So hopefully all these 3 points, remember there are the 3 points are really great points to treat for the what indications? Pituitary gland, the pituitary gland, pituitary hypothalamus and also thyroid, parathyroid. What are the major functions of this? You remember the pituitary again divided into 3 segments. One to be known as the anterior pituitary, the second is the middle pituitary, the other one is the posterior pituitary. When there is the anterior pituitary, but it's the major role to produce lot of hormones which is required for the growth hormone and gonadotropic hormone, the sexual hormones, all will going to release by activating this point. Luteinizing hormone, follicular stimulating hormone, all are very much essential. When the follicles are good, then the estrogen progesterone level is good. When the luteinizing hormone is good, then the ovulation is good. Further, there is the testosterone level is going to increase. So therefore the pituitary, anterior pituitary is good. When you wanted to add up the another point, anterior pituitary point, you just use the GB21 and further you can add up this angio 3, 3.5 as well. Then you wanted to use the posterior pituitary. Posterior pituitary releases the 2 hormones, one to be known as the oxytocin as well. Oxytocin is love hormone, or maybe it's required at the time of the labor or the delivery time to contract the muscles, and also luteinizing hormone or the lactating hormone. That also very much essential for the production of the milk secretion. So therefore you wanted to use the posterior pituitary hormone, that to be known as a Vangu. To means head, Vangu is the gallbladder 12 point. Then the middle pituitary or the intermediate pituitary gland, so that to be known as a use the same point. Along with that you just add up the another point to be known as a finch, that is the gallbladder 20. Gallbladder 20, gallbladder 21, gallbladder 12 and then Sanjo 2, Sanjo 3, Sanjo 3.5. These are the entire points are really amazing point to treat for what indication? Pituitary gland. If the pituitary gland is good, several hormones will going to release. Do you know that master gland to be known as a pituitary gland, which is connecting to the pituitary hypothalamus. Hypothalamus giving the signal to the pituitary. It releases lot of the hormones, which is very much essential. Right?
Increasing height.
Sir,
Yes, increasing.
Sir, I saw you treating this for kidney also, sir.
Yes, good. So this is also to be known as a adrenal gland also to be activated. No doubt I told you Sanjo 1 is adrenal gland. Along with that this point also good for the adrenal gland. Do you know as per the Sujok system where exactly the renal system is located? So yeah, exactly this treatable for the left side of the kidney, but this treatable for the right side of the kidney. So the kidney superior gland to be known as a adrenal gland as well. So therefore that also good point to treat for the kidneys and also adrenal gland as well, to treat for the many indications. Obviously this particular region, the people who are suffering for the back pain as well, I just selected because kidneys are the reason to cause the back pain as well. I just activate the kidney point here and another kidney point here, and this the back points as well to treat for the back. So therefore, however, whenever there is a point is coming, your intuition, your intention, and also the way you are treating to the patient, the feeling you feel that yes, I am treating to the pituitary gland, but that will be directly, indirectly will be activated. By the way, no doubt the endocrine meridian will be useful to treat for that condition as well. So hopefully we can recognize this. But by the way, this point is the shoe stream point, but this point to be known as the ing spring point. But ing spring point is good point to treat for the all the febrile related condition as well. Sanjo 2 also good point to treat for the fever and also kind of the malaria and kind of the chillness conditions can be treatable. And Sanjo 3 is the great point to treat for the shoulder brachial syndrome. Remember, is the my successful point to treat for the many more conditions, because one single point treat for the new hundreds of the disorders. In that case, when I apply the needle, When I apply the needle Sanjo 3, when the patient is complaining, I do have the right side my shoulder pain, I just use the select the Sanjo 3 point. Here I just apply Sanjo 3, just activate it to the upward direction to treat for the right side shoulder pain is treatable by using the Sanjo 3 on the opposite side, but indirectly will be helpful to treat for the shoulder brachial syndrome, or else the people who are suffering for the adhesive capsulitis or maybe the frozen shoulder or some other shoulder brachial syndrome. That time you just ask them to give the pressure in this region, and definitely that have the positive impact. Every day 2 to 3 minutes the patient should give the pressure on that region, but obviously the shoulder pain slowly will get relief. But within seconds also patient feel more comfortable once we just activate strongly. But remember, there is a vein is there, but here is the dorsal carpal vein. When you try to, because she put it a lot of mehndi over here, but I think somebody we can see, you can see this veins to be known as a dorsal carpal veins. But this dorsal carpal veins you shouldn't damage. You shouldn't damage this vein, because Sanjo 3, there the vein is there, but this vein is the basilar vein and also cephalic vein. Cephalus vein here, this is the basilis vein. Basilis vein will become the dorsal carpal vein. So that vein you shouldn't damage. So therefore we can recognize in that way, but we can apply the needle. Sorry? Yeah, you can use the perpendicular, you can use the like this. Yeah, we can use it. For example, now we wanted to pituitary gland, we need to activate. You just apply the towards that, or you can apply the perpendicular insertion as well. In that way also can be possible. Perpendicular, you just do it, because this entire system is endocrine system. Yeah, I am just targeting to the entire. One is the thyroid, parathyroid, and also thymus and pituitary gland. All are connected to this region. We can apply perpendicular, or you wish to apply upward direction. You cannot apply because here there is a bone. Because the metacarpal bones, the starts from here at the bases. There you wanted to apply on the skin surface, you need to apply. But here I applied to the deeper level, to the lumbrical muscles, which is the deepest muscle of the palm. That also reached over this region. That's the reason we just apply in the lower portion. One or other way will be good. Now the coming, hopefully we completed.
In opposite direction.
Yes.
So you initially applied.
Yeah, opposite direction towards the, yeah. Why I applied towards this? Because there is a thyroid and parathyroid gland. Because the pituitary gland should give the command to the thyroid and parathyroid gland in the lower portion. Because once is connected, right? So hypothalamus is connected to the pituitary, pituitary is connected to the thyroid, thyroid is parathyroid, again it is the thymus, again it is the pancreas, again it is the gonads. Like that is the connected. So in that way I just applied. But now let me see, there is the another point. All the endocrine system we were completed right now.